If you run a medical practice in Virginia, you've probably researched best managed IT for healthcare at some point. And you've probably found lists that aren't much help, generic MSP roundups based on Google reviews, written by people who've never worked in a clinic. This video is for practice administrators and COOs who need to make a real decision, one that affects patient data, HIPAA compliance, and your ability to keep the doors open. Here's what most of those lists won't tell you. Virginia healthcare IT isn't like most of the country. If your patients include federal employees, military families, or contractors, especially in Northern Virginia or Hampton roads, your threat profile is different. Ransomware groups don't just want your billing data. In some cases, they want the health records of people with security clearances. That's not a hypothetical. It's an active threat pattern. On top of that, Virginia has specific breach notification requirements. If an incident affects 1,000 or more Virginia residents, your practice has to notify the state attorney general, not just your patients. Most MSPs have never heard of that requirement. Your IT provider should be able to walk you through that workflow before something goes wrong. When you're evaluating an IT provider, most practices ask the wrong questions. They ask about price and response time. Those matter, but they're not the hard part. Here's what to ask instead. How do you handle a ransomware incident specifically? Not generically, specifically. What's your detection method? Do you have 24/7 coverage, or does that mean a ticket queue? Ask about your EHR and practice management software by name. An MSP who's worked with your platform is faster and cheaper to work with than one who hasn't. Ask about BYOD. Bring your own device. If your staff are using personal phones or laptops to access patient data, that's a HIPAA compliance issue that compounds fast as you grow. We talked to a startup medical practice recently that had doctors and staff on a mix of personal devices. Ian McRae, our founder, walked them through what that means at scale. More complicated device management, more liability exposure, and a compliance problem that gets harder to fix the longer you wait. They hadn't thought about it that way until it was laid out in plain terms. And ask about AI. Your staff are already using AI tools, whether you know it or not. Your IT provider should have a clear policy on what's allowed, what isn't, and how to handle staff using unauthorized tools that may be processing patient data. After-hours coverage is one of those things that sounds like a minor detail until it isn't. When a system goes down at 7 a.m. on a clinic day with a full schedule, we'll respond during business hours is not an answer. EN Computers includes after-hours coverage for critical and work stoppage events in our fully managed plan. That means a callback from a technician within an hour, not an automated ticket. That's a specific commitment. When you're talking to other providers, ask them for the same level of specificity. We put together a full guide to choosing managed IT for Virginia healthcare providers, including a realistic pricing breakdown, what questions to ask during vendor evaluation, and what separates a provider who's genuinely prepared for this market from one who just says they do healthcare IT. The link is in the description. It's free, it's specific to Virginia, and if you're in the middle of this evaluation right now, it'll save you time.